Good afternoon to everyone. My name is Patsy Wiley, Chief Health Promotion Officer in the Ministry of Health, Wellness and the Environment. I would like to welcome you to this press conference on dengue fever outbreak and what is the public health response by the Ministry of Health, Wellness and the Environment. Let me thank you all for being here. We have this afternoon a team of presenters. First, we'd hear from our Chief Medical Officer, Dr. Simone Kieser-Beach, followed by our epidemiologist, Ms. Tamara Bob, Dr. Jose Davy, Infectious Disease Specialist, Dr. Mishka Duncan-Adams, Consultant Pediatrician at the Milton Cato Memorial Hospital, Mr. Elliot Samuel, Chief Laboratory Technologist, and Mrs. Shamanti Laban, Acting Supervisor at the Vector Control Division. First, let me invite our Chief Medical Officer, Dr. Simone Kieser-Beach, to address you.
Good afternoon, everybody, and thank you for coming at such short notice. So I'm just going to give a brief overview, and then the heads of the different departments or the representatives, they will give you the details. As of yesterday, we had 374 laboratory-confirmed cases of dengue fever in St. Vincent and the Grenadines. I just want to explain that a bit, in that these are the persons who had laboratory tests. It does not take into account those persons who may not have had a laboratory test, but rather we know that there are other persons who would have dengue and not be tested. I just want to give you an example of the level of demand on the services. In all of August, we had 50 persons coming to the emergency room at the Milton Cato Memorial Hospital with a diagnosis of dengue fever. As of September 20th, we had 167 persons seeking care, of which 59 were admitted. 37 of those were children. So far, we have reported 2 deaths, and this report is based on laboratory findings. So we have 1 middle-aged female and 1 9-year-old male, both from the Calicut district. In terms of our response to this outbreak, I'm sure some of you will remember that back in June, July, we did releases stating that we were noticing an increase in the number of dengue cases. And from then, we started putting out information about how do you reduce your exposure. Basically, we are stressing source reduction because remember the dengue is spread by a mosquito. So we have continued increasing our response, and we have our dengue response plan. Estimates for the cost of this plan in terms of health promotion, the most important component, we have estimates to spend another $29,000 in the next few days, and that would be to increase our persons' understanding, both patients and healthcare workers, in terms of what's required. In terms of vector control, as we mentioned, the decrease in the vector, which is the mosquito, which causes dengue, we have an estimate of $210,000 required to pay for that. And we are also going to employ an additional 10 doctors and 6 nurses. Why do we need to employ additional staff? Because we have to do what we call surge capacity. As I mentioned just now, we have had 167 persons turning up at the emergency room at MCMH just for dengue. So this doesn't take into account the regular persons who visit. So we need to be able to treat these persons. A very important part of dengue management, as Dr. Wood described, is the early intervention in moderate cases. That's how you're going to protect and save lives. And so we have to increase our capacity to provide that care. So besides the doctors and nurses, we are also going to extend services at Kingstown District Clinic to 7 p.m. as of today. as we mentioned in our press release yesterday, we would utilize the Argyle Isolation Facility, and we are also increasing beds at the Milton Cato Memorial Hospital to house the additional cases. In terms of support, we have also reached out to PAHO in terms of additional support for health promotion, vector control, and also for specialist services. As you've noted, a lot of the reports have been that we have increased numbers of pediatric cases. Our under 15 numbers are around 51%, and we're having challenges in terms of the management of these cases, especially where we have renal impairment in children. So we have asked PAHO to help us with a pediatric nephrologist, and we might also get other support as needs be. So I just wanted to give a background here, and I'll hand it back to Ms. Wiley.
Thank you very much, Chief Medical Officer. At this point, I'll invite our epidemiologist, Ms. Tamara Bob, to give you the epidemiological profile. We'd first have all the presentations, and then we take your questions.
Good afternoon, everyone. So we're going to take a look at the dengue situation as well as touch a bit on COVID-19. Okay, so let's begin by looking at the mosquito-borne diseases overview. Now, dengue is endemic to St. Vincent and the Grenadines. This means that every year we always have cases of dengue. However, we have had outbreaks, which means that the cases are higher than expected for that particular time of year. Now, we've had 2 recorded outbreaks recently, that is in 2010 and 2012. And as you can see on the slides, the blue bars denote the cases of dengue. So if you can look at 2010 and 2012, you see those were much higher than the other blue bars coming forward. We also had outbreaks of chikungunya, that's the red bar, and Zika in 2016, that's the greenish bar there. Now we're looking at dengue virus cases in St. Vincent over the last 10 years. As you can see, we're again looking at the outbreak years. 2010, there's a peak, 2012, and then the cases went down for a long period of time. However, in 2020, somewhere in July, we noticed that the number of cases was starting to go up, and so we provided that alert to the relevant persons. In July, we had around 47 cases, and as the CMO would have just mentioned, we have 374 cases as of yesterday. So we're going to look at the statistics. These are the laboratory confirmed dengue infections by age group. We have the majority of infections in persons under 25, but around 53%, are children under 15 and under. If we look at the next slide, we're now looking at the distribution of these cases in terms of the health districts. The majority of the cases are in the Georgetown Health District, which covers communities from Georgetown North. We have Pembroke Health District, which covers communities between Camden Park and Barley. And then we have the Kingstown Health District, which is, of course, Kingstown and surrounding areas like Sion Hill, Sharps, in that general vicinity. We have a few unknown cases, unknown locations, sorry. This is because we generally get information from our private facilities as well, private laboratories, and sometimes the information is not complete, but we get general information in terms of the age groups and the gender and so forth. Next slide. This is a map again showing you the distribution of the cases, and we have again Georgetown, Pembroke, and Kingstown Health Districts highlighted. So in terms of, we know that there are 4 strains of dengue that can circulate. We sent some samples to the Caribbean Public Health Agency lab for serotyping to see what type was circulating here or is circulating here at the moment. All of the samples returned as type 3, and we plan to send off some additional samples to ensure that it's just this one type that is circulating. Some research showed that in previous years, the type 3 was also the most prevalent strain circulating. The years that are missing, the data is not available, but we can see the majority of the times we had type 3 circulating, and in our outbreak of 2010, however, we had type 1 and type 2 circulating. Okay, so this is just a bit about COVID. We have been doing screening, which is the rapid antibody tests. We have done approximately 2,055 persons, and we have covered a wide range of persons, including healthcare workers. We have done frontline staff for the Argyle International Airport. We've covered the accommodation sector, teachers, farmers, van drivers, conductors. We've also done some employees of our ferries to the Grenadines, supermarkets, shops. We've done quite a bit of our footballers, and we've also done fisher folk, prison officers. We've covered a wide range, but we continue to do our screening. And of course, this is our dashboard that is published every day. This is the one from yesterday evening. We still have 64 confirmed cases of COVID-19. To date, we have tested using PCR 4,778 persons, and we have a few results pending, which you, of course, will get the report on that this afternoon. I think that's it from me. Thank you.
I now invite Dr. Davy, our infectious control specialist, to the microphone to address you.
A pleasant good afternoon to everyone. I've been tasked with telling you a little bit about dengue. I promise not to give you a science lesson. I know you won't fall asleep, even if I had to, but I'm just going to tell you a little bit about dengue. So dengue fever is a viral illness. Viral. There are 5 types of dengue, with only 4 of human interest. The 5th one we're not really interested in. There's a graph up there that's probably going to confuse you, so I would summarize it. So there are different stages. First of all, you know that there's an incubation stage for all viral illnesses. And this is just a few days for dengue fever, about 2 to 7 days. So the mosquito would bite someone who has the illness, whether or not they know it, and then bite someone else who was previously well. You go through the incubation period, and then the first stage you're going to have of the illness is called Febrile Stage. So during this febrile stage, you may have fever. When I say may have fever, everyone experiences an illness differently. There is also what we call a subclinical form of the disease. So not everyone would get high fevers. But usually dengue is characterized by very high fever. Persons may also have joint pains, back pain, headaches, and it's usually the headache that's behind the eye, which we call in medicine retroorbital pain. There may be a reddening of the skin, which we call exanthema. There may be nausea, vomiting, and lots of our folks are having diarrheas as well. And not to mention, there's also joint pain. So these are the primary symptoms that you would have during the febrile stage of the disease. The next stage of the disease, and this is usually around the 4th day of illness, the 4th day of symptoms, we move to the critical phase of the disease. Some persons may feel a bettering, while other persons may feel really worse. And this is where they may go on to have what we call warning signs. And I need you to pay special attention to the warning signs. There can be severe abdominal pain, which was not previously noted. vomiting to the point where the persons cannot keep food or liquids down. There may be lethargy, where the person is droopy or they're just restless. And there may be bleeding from any and everywhere you can think of, literally any and everywhere. So the person may brush their teeth and find that the gum is bleeding. They may also have extended menses or periods, or they may have nosebleeds, you name it. Wherever someone can bleed from, they may bleed from. Hence the reason why we say dengue is a hemorrhagic disease. After the critical phase, we expect persons to recover, so they move to the recovery phase. And believe it or not, all of this happens in just 1 week. So the virus would be in your body for 1 week. But unfortunately for some persons, even though the virus is gone, they're still left with maybe a little weakness. And the literature states that people may have joint pain for as long as 3 years. But that, of course, is quite rare. So these are the signs and symptoms that may occur if you have dengue fever. Of course, there are persons who are strong and may only experience a little bit of joint pain for an hour or two, or a day or two, and then it disappears. So it's important that everyone pays attention to what's happening to them. So if you have a headache, it's good to note that you have a headache when that day is, because that's when we need to start counting your days. Because as mentioned before, day 4 is really the important day, where you're either going to get really better or you're going to get really worse. So to mention again, for emphasis, the warning signs, and the public must note this. If you are having severe abdominal pain, you're vomiting to the point where you're not keeping liquids down, you're droopy, well, the family members would notice this, and you're restless, or there's bleeding, there is an urgent need to seek immediate medical attention. For children, you may notice that they would not be crying a lot, and I would leave the pediatric part because I see Dr. Duncan Adams here, so she would take her thunder for that. So the management of dengue lies in proper hydration. When we say hydration, we're talking about taking in enough fluids, liquids. I tell my patients to drink water, coconut water, and fruit juices they make. I say that you make because you want to ensure that the source of juice is clean, because you don't want to add gastroenteritis on something that you already have. So you make your own juice, you drink your coconut water because you need the potassium. Dengue has no specific treatment. You would take paracetamol to help with your headaches and your fevers. Do not take ibuprofen or Advil or any of the other NSAIDs, because this would increase the chances of you bleeding on the inside. So paracetamol every 6 hours, that would set you straight. If that's not working, your healthcare provider would prescribe something that is good for you and that will keep you safe. So in a nutshell, and I see everyone is still awake, that is the management and treatment of dengue fever. Thank you.
Thank you very much, Dr. Davy. With us in the room is Dr. Mishka Duncan Adams, who is a consultant pediatrician assigned to the Milton Cato Memorial Hospital. And as Dr. Davy indicated, she would talk about what is happening with our children as it relates to dengue. Dr. Duncan Adams.
Hello, good day. Thank you. So I'm just going to speak a little bit about what we have been seeing with respect to pediatrics and dengue. I'm not going to repeat everything that Dr. Davy said because she did a very thorough explanation on the clinical manifestations that are generally seen in dengue. However, I want to speak a little bit about how smaller children may actually manifest signs of dengue. Now, a smaller child who is unable to say that they have a headache or anything like that may be found to have high fevers, decreased appetite, may be more irritable than usual. So you may have a baby that is crying and is non-consolable as much as you try to console this child, and the appetite would have decreased. Another thing that they may have besides the high fevers and the irritability would be that rash. So that rash to the body, that is a maculopapular rash, is something that is also very characteristic of dengue. They may have joint pain. Smaller children, you may notice that they do not want to walk or lie on the ground because of the joint pain. They are very achy and may be noticed to have vomiting, diarrhea, abdominal distension, and bleeding, as Dr. Davy would have said before. Now, in light of the fact that children are smaller beings, they tend to get easily dehydrated. And this is something that we are very concerned about because we do have an increase of dengue in the country. And a lot of children will be having fevers, they will be having diarrhea, they will be having vomiting, they will be having decreased appetite. All of these are factors that would contribute to dehydration. If your child is sick and you suspect that this child has dengue, it is very important, and the smaller the child, even more important, that you check a healthcare provider, that you try to have your child hydrated as much as possible. And Doctor spoke about some of the things that we can use for hydration. So we have our coconut water, we have our oral rehydration salts, you up on your fluids, and for smaller babies, increase your breastfeeding, okay? Keep the child hydrated. But we also have to not only monitor if this child is being hydrated by taking in fluids, because they're also losing fluids through fevers, through vomiting, through diarrhea. So you have to be very vigilant on their urine output. How much is this child actually urinating in a day? How many pamper changes are happening? If you notice that there is a decrease in the number of pampers, you need to seek a healthcare provider, and seek a healthcare provider in due time, not waste time, because children become very dehydrated at a quicker rate than adults. So that is something that is very important that I would like to transmit. The treatment and management for dengue, we manage, as doctor said, with pain relief and fever relief. Paracetamol is what is indicated in this case, and hydration. Those are the mainstay of treatment. It is usually self-limiting, and after a few days, the person gets better. However, in few cases, if not opportunely managed, or in some cases, even if you had opportune management, persons can progress to have the most severe form, which is the hemorrhagic form. We would have to do more intensive therapy. Day 4 is a critical time, but even if your child is sick before day 4, for doing the dengue test for confirmation, it is still important that you seek a healthcare provider. So if you have a small child and child is not taking in sufficiently, not peeing sufficiently, you don't have to wait until you have a confirmation to do management. And that is something that is very important. You don't have to wait on the confirmation to start the management. The confirmation helps us in the long term for epidemiology, for long term looking at what we could expect. But at the end of the day, the management starts as soon as the person is ill, okay? So hydration, fever relief, and advanced care in the need that, if it's needed, if we have hemorrhagic symptoms. Okay, thank you.
Thank you very much, Dr. Duncan Adams. Mr. Elliot Samuel, who is the Chief Laboratory Technologist, he is the one who would give the results of the various tests that is being done. So I now invite him to make his presentation. Mr. Samuel.
Thank you, Ms. Wiley. Good afternoon, all. I am going to be very brief with my presentation. I'm going to get to the salient points. Just to say that testing for dengue virus is done at the MCMH pathology laboratory. So we are not doing a PCR analysis. We are actually doing antigen antibody detection. And we actually have it's a highly sensitive and specific assay that we are using that is designed to detect what is called an NS1 antigen and antibodies to dengue. Now, the NS1 antigen is actually present in the specimens of persons 1 to 9 days after the onset of fever. It therefore means that the physicians, the clinical care team, can have a dengue test done as early as 1 day after that person presents. Having said that, we do not test every sample. We are primarily focused on hospital admissions, children under the age of 5, pregnant persons, and persons who are coming from areas where there is very little incidence of dengue. In terms of the cost per test, because I've had a lot of calls about how much do you have to pay, just to note that dengue is one of those tests that do not attract a user fee. It's a public health test, so there is no cost prohibitiveness where getting a dengue test is concerned. And I will make this the end of my presentation. Any other questions I can answer for you? Thank you.
Thank you very much, Mr. Samuel. Our final presentation would come from Mrs. Shamanti Laban, who is the acting supervisor at the Vector Control Division. I know very often we tend to ask about the Vector Control Unit and their presence in the community. So you're seeing that it takes much more than share with you their role in the reduction of the vector.
Thank you. Good afternoon, everyone. So I'm going to speak a bit on what the unit has been doing. Now, as would have been said, dengue is caused by a mosquito, and more specifically the Aedes aegypti mosquito. And this particular mosquito is also responsible for the transmission of chickpea as well as Zika, as the Zika virus, as would have been mentioned in Ms. Bob's presentation. Would have had outbreaks of these diseases in 2014 and 2016 respectively. This mosquito can be identified by white stripes that can be seen on their legs as well as their body. In 2019, CARPHA would have asked member state countries to prepare for a dengue outbreak. Some countries have had an outbreak of dengue during this period, for example, Jamaica. So as a result of this, the unit has been planning for an outbreak since 2019. And would have responded to the dengue outbreak in 2020. Now the unit has adopted an integrated mosquito management, which is an effective program that utilizes a combination of techniques to control mosquitoes at all life stages. So these are some of the things the unit would have looked at: entomological surveillance and monitoring, health education, the legal aspect, mapping and data visualization using GIS. So these are some activities the Vector Control Unit has been doing in 2020. Source reduction activities, which include the physical elimination of mosquito breeding sites, the application of larvicide, fogging operations or adulticiding, and this actually targets the adult stage of the mosquito. We've had one-on-one communication with householders, informing them about mosquito breeding sites and how to be able to identify them. Health education sessions at clinics, schools, continued surveillance at ports of entry, inspection, treatment, and placement of fish in river, stream, and drainage systems, working along with the health promotion unit in order to educate the public. Now, the immature stages of the mosquito, there are 4 stages of the mosquito. So the immature stages, which are the first 3 stages known as the aquatic stage, these are more vulnerable and they're easier to eliminate as compared to the adult mosquito. And this is the one that's the vector that transmits the disease. So it's important to eliminate both the immature as well as the mature stages of the mosquito, and therefore the unit is soliciting the assistance of the general public in the fight of these small but very deadly creatures. So your involvement is of vital importance, and there are some things that can be done to eliminate mosquito breeding sites around homes and general environment. So it's important, if you have a water container and you're not using it, it's important that you overturn this and store it in a dry place so that it will not be able to collect water. It's important to screen drums and other water containers to prevent the entry of mosquitoes. It's important not to litter, because as much as a teaspoon or a cup of water is enough for mosquitoes to actually breed in. Tires should be stored in an area where water cannot accumulate in them. And persons can come up with innovative ways in which they can use tires. Okay, for example, for planting. And you can also cut the bottom out of the container to prevent water from accumulating as well. Discard all freezers, stove, and refrigerators from around your home. This can also be a potential source for, this can also be a source of mosquito breeding. So million fish can also be placed in larger bodies of water, and it's important to make checks around your home around once per week for any mosquito breeding sites. And this can be identified by looking for the immature stages. For example, you can check to see if you see the larvae. Most persons will call them wrigglers or worm. They can be seen in a water container. And you can also see the pupa, they are comma shape. So the larvae, they usually come to the surface for oxygen. So by checking your water container, you can see these, and then you can realize that there's you have mosquitoes breeding, so it's important that you get rid of the water. All right, so personal protection for mosquitoes includes applying repellent, and it's important that you check the hours of effectiveness for this particular repellent, because each repellent has a different length as it relates to effectiveness. For example, DEET will have up to 6 hours, and there's also citronella and eucalyptus oil, which have a shorter period for about 2 to 3 hours. So it's important to sleep under an insecticide-treated bed net, and it's important to know that the Aedes aegypti mosquito, it's known as a day-biting mosquito. So when sleeping under a bed net, this should be utilized during the day. And it's the female mosquito that usually transmit the disease. And it's also important to screen windows and doors to prevent the entry of mosquitoes. And to conclude, I'll just like to remind everyone that at this time, vector control responsibility, it requires the involvement of everyone, and not only the vector control unit. Everyone has to play a role, and remember, without a drop, the cycle would stop. Thank you.
Thank you very much, Mrs. Laban. We now invite questions from the media, and if you can kindly identify which media house you represent, we'd appreciate it very much, and to whom you're directing your question. Yes?
Okay, yes, good afternoon. Dale Silva with the Vincent newspaper. My first question, I think it was mentioned that the dengue fever that is about right now, it's type 3. I think Mr. Bob would have gone ahead and explained some of the symptoms, but in terms of the severity, is type 3 severe?
So, as is known, dengue is endemic to St. Vincent and the Grenadines. You've seen the spread where we've had exposure to 1, 2, and 3. The problem with dengue fever is that once you've been exposed to any one of the viruses before, If you get another serotype, then you are more at risk for having severe form of the disease. For example, let's say, I'm not going to name anyone, let's say person A contracted type 1, let's say maybe 2-3 years ago. If type 1 is circulating again, more than likely, if they get bitten, they would have a very mild form of the disease or not be sick at all. If type 3 comes around, and they would have had one before, then these persons are more at risk for having a more severe form of the illness. So whatever you've not gotten before, if you get a second bout of another serotype, then there's a severe form of the disease. So we're not trying to blame any one subtype really, but it's your exposure, your previous exposure. And of course, if you have comorbidities, and then it depends on how much you hydrated. It's very hot these days, people get dehydrated, so there are lots of contributing factors.
Good afternoon, Kensington Chancellor of Viruses and the Caribbean Media Corporation. Is there anything in the geographical areas where we see the highest number of cases that might be contributing to this reality?
It's lava literature.
Okay, thank you. So basically, we've seen a number of cases in the Kingston area, the Pembroke area, as well as Calqua. These are the three areas where we've seen most cases. Now, the reason for this could possibly be these areas are high-density areas. For example, Kingston, you have a lot of persons, traverses, and so on. Calqua is also is one of the most highly populated area in St. Vincent and the Grenadines, according to the census that was done. And so these can be contributing factors as it relates to seeing high numbers of cases. So it can also be related to how many persons are living there, hence the reason why you're seeing such a large number of cases in this particular area.
Okay, my next question is, to what extent are dengue and COVID symptoms similar, and what steps are taken to rule out COVID in some of these cases?
So, as you've heard about the signs and symptoms, in the initial stages, they're mostly similar, and they're both viral, with the headache, the fevers. So once a person presents with these symptoms in this day and age, 2020, a SARS-CoV-2 test is performed on these individuals once they present for healthcare. That test is also done.
Has the ministry explored whether there is any link between the reopening of school and the upsurge in dengue cases?
In terms of the link, I think it has more to do with the fact that this is a day-biting mosquito. Okay, so typically a day-biting, but we have been seeing lately that it can bite earlier in the morning and late in the evening. But the main thing is during the day. So wherever you work or wherever you are. So the children have been in school. But something else we also want to look at. The last big outbreak was in 2010 and 2012, which means that anybody born after 2012 has not had significant exposure. So we have what we would call a virgin population, persons who have not been exposed to dengue and so don't have immunity to it. And that would be in the 8-year-olds and lower. So we have a combination where you have persons where they are during the day, and but also you have a large population of persons who have never been exposed to dengue, and that's in the 8-year-old and under age group.
How long can we expect this to go on before it gives us out on us? Does this have to do solely with the way the vector control unit?
I would say it's a shared responsibility, Mr. Compton. And so it is not just the vector control unit, and they will be the ones who will go and do the fogging and advise. But what we are doing here today, we are suggesting, we are pleading, we are asking that everybody takes responsibility, which means we decrease exposure. And how do we do that? We make sure we're not collecting, we're not breeding mosquitoes, which is against the law, actually, and there's a fine for it. But we are asking persons to take care, and we will take care, and together we will deal with this. So we decrease exposure by decreasing the source. So we move in the mosquitoes, we protect ourselves. So yesterday, the Ministry of Health wrote to the Ministry of Education and advised that they consider allowing children, students, to wear long pants and long sleeves so that they would decrease the exposure, because this is something we are saying. So because if you have light colors, long sleeves, long pants, the mosquito can't bite you as easily. So this is something we are asking. Ms. Laban spoke about the insect repellents. We are talking about clearing the bush around your homes, clearing the bush around where you work. We all have a responsibility. And so wearing nets, using nets where you sleep. We have nets in the hospital too. So if we all work together, we can end this much sooner rather than later. Mr. Compton, I said that the Ministry of Health wrote to the Ministry of Education recommending, okay? It was a recommendation. I know there are some schools already where that is allowed. It was a recommendation.
Forgive me for not knowing this, right? But growing up, I used to see, when I grew up in the countryside, Mesopotamia to be specific, I would see persons from the vector control unit come around regularly, checking properties and
Your question, the vector control unit has not ceased operations, and we continue to work with a number of communities. I can't recall off the top of my head when was the last time, but they were in the Mesopotamia area, but I'm certain.
He does not live in Mesopotamia.
Oh, okay. But they continue to do source reduction activities and so on, check around your homes and advise householders on what they should do. Okay? Okay, but as I've said, we have been working like tirelessly every day in several communities throughout St. Vincent. We also have officers in Beckway as well as in Union Island, and they have been working.
I don't know if I'd be permitted on that.
And let's hear from the others first, if they have any, and if not, then we'd come back to you.
Okay, my question is simple this. How does the ministry respond to the view among some members in the public that the ministry dropped the ball, quote unquote, or fell asleep on this dengue outbreak?
You know, Mr. Chance, just on Saturday, a communications consultant said to me, you know, Vincentians, and I shared it with our health promotion team yesterday, oftentimes it seems as if Vincentians have to be, I might get licks for this, but anyhow, my back is broad, clobbered over the head before they pay attention. If you check all of our social media, all of our press releases, as Ms. Laban said, we've been in the field for months talking about dengue. We even developed a plan because we are looking at hurricanes, COVID, dengue. We have been out there giving messages. We have the SVG Health page on Facebook. I suggest that every Vincentian become very familiar with that page. There's a lot of information there. It's unfortunate that Vincentians think that we've dropped the ball. However, we will continue working because that's what we do in the Ministry of Health. We understand our role, but we understand that we can't do it without the public. And we will continue to try to engage the public so that we can all have a healthier life. Okay, I'm going to answer a question that apparently was posed I'm sorry, Mr. Chance, are you finished? Yeah, you have another question?
Asking the question.
Okay, then. Another question had come in.
From Extreme.
It was about,
What are the protocols for students who present or develop dengue fever symptoms during school hours?
okay, so as you know, with the COVID protocol, we are taking temperatures. And we had asked all schools to develop a close relationship with their healthcare providers in their districts. And so they should have a relationship where if a child has a fever, they can communicate with the healthcare provider in that area. And that is what we recommend, that they communicate with the healthcare provider. We want to, however, stress, as Dr. Duncan Adams said, Dr. Davies said, especially with children, the window of going from not feeling so well to being very ill is very short. So that anybody with a fever, we need parents, guardians, teachers, everyone to be very aggressive about seeking care. Right now, our institutions are very full. So the polyclinic in Bokama yesterday had 100 patients in one day. And this has been reported throughout the system. But we want persons to still seek care. Ask the question. And that is how we are going to respond together.
I think these questions were sent by Extreme Radio. The first was answered when we talked about the allocation of additional space to take care of clients who are affected. The second one, the third, in terms of statistics. And the fourth question, it has been 3 weeks since the first suspected death. Reason for such a delay in sharing information with the public. And then the final question, are there plans to increase the turnaround time for results from the lab?
Okay, so I'll take both of those. It was said it was 3 weeks. I'm not sure what case they're speaking about, but as we said, in order for us to come to a diagnosis, a decision that this is a dengue death, we have to go through all of the investigations. We have to make sure the death certificate and what is reported is what is confirmed by the lab. So if there was any delay in that, that would be the reason. And the other thing in terms of the turnaround, in terms of getting tests done. So, Elliot, you want to do that? The same 24 hours, that's the turnaround time. That's the turnaround time, I'll stick with that. There was also we addressed the matter of COVID and you can have a cross-reactivity between the antibody tests for dengue and COVID, but we are very aware, and so we are doing our screening for COVID with all of the tests. Both persons who died, they had PCR tests done, which means that's a swab, that's the gold standard, and we had results from St. Vincent, and we also had results from CAFA, all negative.
JP Shimon, Ascot News Network. In the morning, I'm wondering, given the number of cases you said was reported and are being reported from the health centers locally, are parents in particular supposed to just turn up at the health center with these COVID-like symptoms, or are you supposed to call ahead? Is there a dengue hotline, you know?
Mr. Sherman, you just mixed two things up there, okay? We said dengue. Initially, yes, doctor said we're talking about a fever. But then it becomes very clear there's a difference, all right? If we go back to COVID, if you have somebody who has what the classic symptoms of COVID are, fever, cough, difficulty breathing. If that is what you have, you pick up the phone and you call ahead. If a child has a fever, a rash, and sometimes the rash is very difficult to see, the child might say, my skin just feels is scratching, or the child is vomiting, that person needs to, you can call ahead, but you also can go to your clinic. Okay?
Any other questions?
technician from NBC Radio. The areas where the dengue fever seems to be arising, you said Calico and you said Bokuma. These areas, I noticed there's stagnant water flowing in these areas. I figure that is where the mosquitoes intensify their reproduction. So something I think they would have to do.
So, just as Mr. You want to deal with it, Neri? Come.
Yeah, sure. Yes.
This is
Greetings
our
to all.
Chief Environmental Health Officer, Mr. Neri James.
Yeah, greetings to all. Yes, those spots has streams, and where the streams are, there are wave action. As a result of that, the flow has been stopped. And we have observed that, yes, they are indeed breeding sites. So we are in the process of having a project to ensure that those streams are being cleared. Okay? But I just want to say to us that health is a shared responsibility. The issue of us waiting patiently for the team to actually fog, it is not the best. So each of us are asked to do each of us part. You can do a simple thing, okay? Inspect where you are living twice per week.
We want to thank the media very much for coming out this afternoon, and thank you for your questions. And we now ask of you that you would share the message, and as Mr. James ended on the note, your health is a shared responsibility. We, in the Ministry of Health, we are responsible for providing the services, but that alone would not work. We also want you to act on the information that is being provided to you. Some of the simple things, looking at your spouting, the vase or vase, whatever you want to call it, in the homes with water. We're asking you, please, to help us, because what we want to see is a reduction in the number of cases. And if 10 of you are living in a community, 9 clean and 1 does not, it does not make any sense that because you can still be affected. So please do your part and help us to send a message. Thank you very much, and have a pleasant day.